Coronaviruses, a family of viruses that commonly occur in humans and animals, are named for the crown-like spikes on their surface that can be seen under a microscope. Of the 7 known strains of the coronavirus, 4 are common human coronaviruses. Typically, these cause mild to moderate upper respiratory tract illnesses similar to the common cold and flu, and sometimes lower respiratory tract illnesses such as pneumonia or bronchitis. Most people will experience a type of common human coronavirus in their lifetime. 3 new strains, called novel coronaviruses, are mutations that occur when the virus is transferred from animals to humans. Previous novel coronavirus outbreaks include a global outbreak of severe acute respiratory syndrome, or SARS, which resulted in 8,096 cases and 774 deaths from 2003 to 2004. More recently, the Middle East Respiratory Syndrome, or MERS outbreak, began with transmission from dromedary camels to humans and affected the Arabian Peninsula in 2012. Coronavirus disease 2019, referred to as COVID-19, is the latest outbreak. It's caused by the human body's reaction to a new strain of coronavirus known as SARS-CoV-2. SARS-CoV-2 evolved from an animal-to-person transmission to a person-to-person transmission and was first detected in Wuhan, China. Early on, many of the patients in the outbreak reportedly had some link to a specific food and exotic meat market. Currently, there is much that is unknown about the transmissibility of this virus. Since its initial detection, the virus has now spread worldwide. The Centers for Disease Control, CDC, and the World Health Organization, WHO, are researching COVID-19, with new information discovered daily. The risk of infection is dependent on a person's exposure. Healthcare workers caring for infected patients and family members in close contact with a patient are at higher risk for infection. Others who may have been in close contact with an infected person are also at risk. At this time, the most accurate and reliable sources of information about COVID-19 are from the CDC and WHO. Some viruses, such as measles, are highly contagious, while others are less so. Because COVID-19 has only recently been identified, its transmission modes are still being evaluated. It's thought to spread mainly from person to person, between people in close contact within 6 feet, through respiratory droplets produced primarily when an infected person coughs or sneezes, or possibly when they speak or breathe. These droplets can enter the mouths, noses, or eyes of people who are nearby. People are thought to be most contagious when they are most symptomatic, the sickest. However, infected individuals can spread the virus to others, whether displaying symptoms or not. Additionally, spread of the disease may be possible through contact with a contaminated surface or object on which the virus may persist, then touching your eyes, nose, or mouth. Community spread refers to the spread of an illness within a community, where people who have unknowingly been in contact with an infected person or persons later develop symptoms of the disease. This is because people exposed to COVID-19 may become carriers before they become symptomatic. Travelers returning from affected locations with community spread are also at elevated risk of exposure. If you have close contact with someone with COVID-19, you may be asked to stay home to self-monitor and avoid contact with others for up to 14 days. The CDC currently considers this virus a very serious public health threat. There are elevated risks associated with travel, close contact activities, and caring for symptomatic patients. Confirmed COVID-19 infections have ranged from asymptomatic to few symptoms to severe illness and death. Symptoms can include fever, chills, cough, shortness of breath or difficulty breathing, as well as muscle or body aches, headache, the new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The CDC considers a person to have a fever when an individual's measured temperature is at least 100.4 degrees Fahrenheit. Also, older adults and people with severe underlying medical conditions such as diabetes, heart, or lung disease may be at higher risk for developing serious complications from COVID-19. The CDC reports that symptoms of COVID-19 may appear in as few as 2 days or up to 14 days after exposure. There is currently no vaccine for the COVID-19 infection. Several immunizations are under development but may not be available until 2021. Numerous drugs are being trialed for use in severe COVID-19 cases. Check the FDA website for the latest status. The best protection is to avoid being exposed to the virus through proactive and defensive measures. As with other respiratory viruses, the CDC recommends frequent hand washing with soap and water. If soap and water aren't available, use an alcohol-based hand sanitizer of 60% ethanol or higher. Other precautions are to avoid touching your eyes, nose, and mouth with unwashed hands, and avoiding close contact with people who are sick. Don't share personal items such as dishes, cups, utensils, or towels with coworkers. Most importantly, either cover your cough or sneeze with a tissue, then throw the tissue in the trash, or sneeze into the inside of your elbow. Clean and disinfect frequently touched objects and surfaces using an EPA or Center for Biocide Chemistry CBC-approved product for SARS-CoV-2. This includes objects and surfaces such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. And if you are sick, stay home. Voluntary home isolation can help prevent transmission to others. Limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home. To practice social or physical distancing, stay at least 6 feet from other people. Do not gather in groups. Stay out of crowded places, and avoid mass gatherings. Keeping space between yourself and others is one of the best tools we have to avoid being exposed to this virus and slow its spread. When COVID-19 is spreading in your area, limit close contact with individuals outside your household. This applies to everyone. Since people can spread the virus before they know they are sick, it's crucial to stay away from others when possible, even if you have no symptoms. Social distancing is especially important for people who are at higher risk of getting sick. If you must go out, the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as in grocery stores. This approach is especially important in areas with significant community-based transmission. If you are sick, coughing, or sneezing, wearing a face mask will help prevent the spread of the virus to others. People who are caring for you should wear a face mask if they enter your room. Masks, including cloth face coverings, are only effective if they're handled and worn correctly. Before putting on a mask, wash your hands with soap and water or alcohol-based hand sanitizer. The mask must cover your mouth and nose with no gaps between your face and the mask. Avoid touching the mask while wearing it, and if you do, wash your hands or use hand sanitizer. A single-use mask must be replaced with a new mask as soon as it becomes damp. Follow CDC guidance regarding the reuse of single-use masks. To remove a single-use mask, use its straps to remove it from behind, being sure not to touch the front of the mask. Always discard single-use masks in a closed bin. When using a reusable cloth face covering, at the end of the day, remove it using the straps, being careful not to touch the front of the covering. Wash it in a washing machine using hot water and detergent, then dry it completely in a clothes dryer on medium or high heat. Wash your hands with soap and water or use hand sanitizer after removing the mask or after coming in contact with other masks. Check the CDC website frequently for updates on what respiratory protection to use and when to use it. If you do become infected, there is no specific antiviral treatment recommended for COVID-19 infection. You should receive treatment as directed from a medical professional, typically a form of care to help relieve symptoms. For severe cases, medical professionals will provide treatment to support vital organ function. If you are sick, you should watch for the following emergency warning signs: trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. If you develop any emergency warning signs for COVID-19, get medical attention immediately. If you need to go to the hospital and you suspect you have COVID-19, the CDC recommends you call 911 and notify the operator that you have or think you might have COVID-19. If possible, put on a face mask before medical help arrives. If you become sick, stay home except to get medical care. Take over-the-counter medicines as needed to relieve symptoms. Stay hydrated and get plenty of rest. Most people have mild illness and can recover at home without professional medical care. If you do go to the doctor or emergency room, avoid public transportation such as taxis or ride-sharing. Call your doctor's office and tell them you have or may have COVID-19 so they can be prepared to protect themselves and other patients better. Stay in a designated bedroom or sick room in your home as much as possible and away from other people and pets. If possible, use a separate bathroom. Wear a cloth face covering if you need to be around other people or animals, both inside or outside of the home. You don't need to wear a cloth face covering when you are alone. Cover your mouth and nose with a tissue when you cough or sneeze. Dispose of used tissues in a lined trash can and then immediately wash your hands with soap and water for at least 20 seconds. If soap and water are unavailable, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Try to stay at least 6 feet away from other people to help protect them. Do not share personal household items like dishes, drinking glasses, cups, flatware, towels, or bedding with other people in your home. Wash these items thoroughly with soap and water after use, or put them in the dishwasher. You should clean your bedroom and bathroom if possible. Wear disposable gloves when you clean and disinfect high-touch surfaces. High-touch surfaces include switches, phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, and bedside tables. Let someone else clean and disinfect surfaces in other areas in the home. If a caregiver or other person needs to clean and disinfect your sick room or bathroom, they should wear a mask and disposable gloves. They should wait as long as possible after you use the bathroom before coming in to clean or use the bathroom. Clean the areas or items with soap and water or another detergent, followed by a household disinfectant. You can be with other people after it's been at least 10 days since symptoms first appeared and you've had no fever for at least 24 hours without taking fever-reducing medication and your symptoms have improved. Depending on your physician's advice and the availability of testing, you might be tested to see if you still have COVID-19. If you are tested, you can be around others when you have no fever, your respiratory symptoms have improved, and you receive 2 negative test results in a row at least 24 hours apart. For travel within and outside of the country, check travel warnings from the CDC. If you are planning to travel, consider your underlying health conditions, intended destination, purpose, and the expected risk. You may be more likely to get infected if you travel than if you stay home. Understanding how COVID-19 is transmitted and taking precautions to both protect yourself and prevent the spread of the disease can keep you and others safe. Visit the CDC website as well as your state health department website for more information on what's happening in your community and make decisions based on current information. What is the most important action you can take to prevent the spread of infectious diseases and keep yourself healthy? It's easy. Wash your hands. Washing your hands removes the germs that might make you sick. This reduces your chance of infection because everyone frequently and unconsciously touches their eyes, nose, and mouth without realizing it. This is one of the ways viruses are spread from person to person. Unwashed hands that contact food and drinks during preparation or while consuming them also allows germs to enter your body. Foodborne illnesses can lead to serious gastrointestinal illness. Also, if you blow your nose, cough, or sneeze into your hands, and then touch other people's hands or common objects, or touch a surface that has been touched by someone who is ill and do not wash your hands, you may also get ill. So, washing your hands frequently and thoroughly may help prevent diarrhea, respiratory infections, as well as skin and eye infections. Washing your hands correctly starts with wetting them and soaping up. To do this, thoroughly wet your hands with clean, warm or cold running water. Then, turn off the tap and apply soap, enough to cover both hand surfaces. Once soaped up, your hands are ready to be washed and scrubbed. Lather your hands by rubbing them together, palm to palm, with the soap, making sure they are pointed down into the sink so the soap and water drip into the drain rather than onto your arms and elbows. Lather the backs of your hands and wrists, and between your fingers by rubbing the palm of one hand over the back of the other hand and interlacing your fingers. Do the same for both hands. Be sure to wash your thumbs and under your nails. Then, rub your hands palm to palm with your fingers interlaced. Interlock your fingers and rub the backs of your fingers with the palms of the opposing hands. Next, rub your thumbs in a rotational motion using the opposite palms. Continue the rotational motion while rubbing your clasped fingers back and forth into the palms of your opposite hands. Scrub your hands for at least 20 seconds. Then, turn the tap on and rinse your hands well under clean, warm, running water. Because damp hands can promote the spread of the virus, after washing and scrubbing, dry your hands using a clean, disposable towel if available, and rub vigorously until they are dry. Alternatively, air dry your hands using a powered hand dryer. And if possible, use disposable towels to turn off the tap and open the bathroom door. If soap and water aren't available, use alcohol-based hand sanitizer of 60% ethanol or higher. If there is visible dirt on your hands, remove the dirt first. The CDC recommends that you apply enough sanitizer to cover all surfaces of your hands and then rub them together for at least 20 seconds. The sanitizer only works if there is enough contact time between the sanitizer and the germs. Following these hand-washing best practices can help you protect yourself and others from exposure to infectious germs.